Hi, everyone, and welcome back to the Revenue Cycle Decoded channel. I'm your host, Gina Cornett, and we are breaking down all things revenue cycle. Today, we are going to dive into one of the most critical and often controversial topics in revenue cycle management, and that is the ethical dilemma of balancing profit and patient care. As revenue cycle professionals, we're in a unique position. We, on one hand, are responsible for the financial health of our organizations. And on the other, we are working in an industry where the primary mission is to care for people. And these priorities can sometimes feel like they're at odds, creating ethical challenges in our daily work. How do we navigate this? How do we ensure financial sustainability without losing sight of our commitment to patients? So, in this episode, we're going to explore the role of revenue cycle in healthcare and why this ethical dilemma exists, some of the key challenges that we face, some practical solutions for balancing profit with patient care, and then why ethical revenue cycle practices benefit both patients and organizations. If you've ever struggled with the tension between your organization's financial goals and patient centered care, this episode is for you. Let's jump in. First, let's take a step back and talk about the role of revenue cycle management in healthcare and why it's such a critical balancing act. At its core, revenue cycle management ensures that healthcare organizations are paid for the services they provide. It starts with patient registration and insurance verification, and it continues through the billing and claims processing and ends with payment collection. Revenue cycle is what keeps the lights on. It funds everything from staff salaries to state-of-the-art medical equipment. And that's where the tension arises because, on the one side, financial sustainability is not negotiable. Without revenue, there is no care. But on the other, patients aren't just customers. They're people who are often navigating the most vulnerable moments of their lives. So when financial processes feel overly aggressive or opaque, it can erode trust and leave patients feeling like profit comes before care. And this creates the ethical dilemma. How do we balance our revenue goals with our responsibility to care for patients? So now that we've set the stage, let's look at some of the ethical challenges in revenue cycle management and how they impact patients and organizations. Let's start with one of the biggest challenges, transparency. Healthcare pricing and billing are notoriously complex. Patients often don't know the cost of care until they receive a bill. And sometimes that's weeks or months later. And when that bill arrives, it's often confusing and difficult to understand. This lack of clarity damages trust. Imagine going to a restaurant, ordering a meal, and then getting a bill a month later with no explanation of the charges. You'd feel blindsided, right? And that's how many patients feel when they get their medical bills. And when patients don't trust the billing process, they're less likely to pay or seek care in the first place. So, transparency is key. But until recently, many healthcare organizations didn't even want to release their prices to the public, making it more difficult. Now there are transparency laws on the books, and healthcare organizations do have to post their prices. And we need to make pricing and billing as clear and upfront as possible. That means providing cost estimates before services are rendered whenever possible. And I get it. Sometimes we don't know what services the patient's going to receive, but we should have a pretty good idea of the services perhaps most commonly rendered. And once we do know the services that the patient is going to receive, depending on what their provider has ordered, that's the time to have a discussion with the patient about what the costs of those services are going to be. We also need to create billing statements that are patient friendly. breaking down charges and payments in plain language. Not only does this build trust, but it also reduces disputes and it improves payment rates. And it's a win win for patients and organizations. And quite frankly, if your organization is concerned about patient satisfaction scores, a medical billing process that leaves patients with a bad taste in their mouth is going to hit those scores and hit them hard. So now let's talk about collections. Unfortunately, some patients don't pay their bills, and recovering unpaid balances is an important part of revenue cycle, but how we approach it matters. Aggressive collections practices like frequent calls or inflexible payment plans, or even sending accounts to collections agencies, although it has to be done sometimes, can harm patients who are already financially vulnerable. And it's especially tough for patients who are dealing with chronic illnesses or unexpected medical emergencies. Now, I get it. Healthcare organizations need to collect payments to stay operational. But collections don't have to be cold or adversarial. Compassionate collections practices like offering flexible payment plans or offering financial counseling or even charity care options when those are appropriate can make a huge difference. Patients appreciate empathy, and when we approach collections with compassion, we're more likely to build trust and get paid in the long run. Denial management is another area where the balance between profit and patient care can be tricky. Often, organizations treat denial management like a reactive process. We wait for the claims to be denied and then we try to recover the revenue. But that approach focuses solely on the financial side and it misses an important opportunity to improve care. If you think about it, a denied claim isn't a financial loss. It also means a delay in patient care often or a gap in documentation. So instead of just reacting to denials, we really need to focus on preventing them. That means we need to train clinicians and we need to train our staff on proper documentation, understanding payer requirements, and giving real time feedback to avoid errors. Especially when we're looking at our front end staff, we really need to be proactive about training them to obtain accurate insurance information from our patients to ensure we're billing the correct payers and then we're not later sending a bill to the patient that should have been paid by their payer if we had the right payer in the first place. A proactive approach benefits everybody. It improves cash flow for the organization and it ensures that patients get the care that they need without unnecessary delays. And then let's talk about the tension between revenue goals and patient access. Many organizations require upfront payments for non emergency services as a way to protect their revenue. Understandable, right? And this makes sense financially, but it can create barriers for patients who can't afford to pay. Delaying or denying care because of financial policies can lead to poor outcomes for patients and it can harm the organization's reputation. Instead, we should put the patient first and prioritize access to care. That could mean that we offer sliding scale payment options, or we partner with charity organizations, or we have a charity policy and a program that patients can complete an application. And if they meet our guidelines and requirements, they qualify for charity care, or providing financial counselors to help patients navigate their options and set up payment plans. By making care accessible, we're not just supporting patients, we're building goodwill and trust that benefits the organization in the long term. And many organizations do have outstanding charity programs or financial assistance programs and counseling programs. And that's all to the better because they are putting their patients first. So, why does this all matter? Why should we go the extra mile to address these challenges? Well, because ethical revenue cycle practices benefit everyone. For patients, it reduces financial stress and it builds trust. For organizations, it leads to better patient satisfaction, improved community reputation, and even stronger financial performance in the long run. And for revenue cycle teams, it creates a sense of pride and purpose, knowing that our work aligns with the mission of care. Let's talk about what we can do to support ethical revenue cycle in our organizations. Here are a few strategies to consider. Train your team to approach billing and collections with empathy. When staff understand the mission behind their work, it reflects in how they treat patients. Use technology to provide cost estimates and real time billing quotes. AI tools can help simplify and automate these processes and make them more transparent for patients. Regularly review and adjust your financial policies to ensure they align with your organization's mission and values. And hire or train financial counselors who can help patients navigate insurance questions, payment options, and financial assistance programs. These advocates bridge the gap between financial policies and patient needs. The ethical dilemma of revenue cycle, balancing profit with patient care, requires thoughtful solutions and a commitment to doing what's right. By prioritizing transparency, compassion, and access, we can ensure that revenue cycle processes support both financial sustainability and the well being of our patients. If you would like to learn more about how to prevent front end denials, take a look at my Front End Denials Decoded course available on revenuecycledecoded.com. You'll learn everything there is to know about managing and preventing those pesky denials from faulty front end processes, including how to work with your team and how to train your front office staff. I'll leave a link in the description below. What do you think? How do you balance these priorities in your role? Let me know in the comments. And if you found this episode helpful, don't forget to like, subscribe, and share it with your network. Together, we can create a revenue cycle that works for everyone, patients, providers, and organizations alike. Thanks for watching, and I'll see you in the next episode. Peace out.